Hello friends, today let's talk about the topic common massage technique, effleurage, kneading, friction, stroking, percussion manipulation and sucking manipulation. Let's start with a brief introduction of this topic. Massage involves working and acting on the body with pressure, structure, unstructured, stationary or moving, tension, motion or vibration, done manually or with mechanical aids. Massage can be applied with the hands, fingers, elbows, knees, forearm, feet or a massage device. Depending on the application and technique used, massage is used to promote relaxation and well-being and is beneficial in treating sport injuries and any other problems affecting the musculature of the body such as postural misalignment and many painful conditions. Massage usually involves applying touch with some degree of pressure and movement. The massage therapist must use touch with sensitivity in order to determine the optimal amount of pressure to use for each person. First, effleurage. Effleurage is a unidirectional manipulation in which the therapist's hand passes from distal to proximal with a depth compatible with the state of tissue and the desired effect. Thus, the manipulation may start at one end and proceed to the proximal space, readying the part to be treated. For example, fingertips to axilla, toe to groin, buttock to axilla, neck to supraclavicular gland. The depth should be such as to push fluid onwards in the superficial vessels. This may be observed especially in the veins of the forearm. The manipulation is performed with the whole hand softly curved and relaxed to fit the part or any part of the hand which fits the part. Both hands may be used together on opposing aspects of the part or may follow one another. As the manipulation proceeds over the part, the hand must change shape to maintain perfect contact. The stance of the therapist is very important as these manipulations often proceed over a considerable length of the body and it must be possible for the therapist to transfer body weight to and fro. Walk standing is usual stance adopted, with the weight bearing transferred from rear to the forward foot, accompanied, if need be, by either or both lifting of the heel of the rear foot and flexion and extension of the knee and hips. The arm will initially be flexed and become more extended, especially at the elbow as the wrist is met. Integration of the arm and body movement must be obtained to ensure a smooth movement of the hand along the part. This is achieved if the arm stretches first, followed by the body weight transfer. At the end of every line of effleurage, there should be a small increase in the depth, that is often called overpressure, and a slight pause, that is in the space, before the hand is lifted off with minimum flourish and return to the distal part to start the next line of work. The next one is kneading. Kneading is a circular manipulation performed so that the skin and subcutaneous tissue are moved in a circular manner on the underlying structure. Circle is described by the part of the hand in contact with pressure on the upward part of the circle, but only for a small segment. The actual range or number of degrees for which pressure is exerted varies with the part treated. On the non-pressure phase of the circle, the hand maintains contact but glides on the next area of the skin a small enough distance to allow the circle to cover at least half the previous area. Great care must be taken to transmit the required pressure to get the necessary depth through the whole hand and not just the heel of the hand. In performing all kneading manipulation, use work standing so that our body weight can move easily from one foot to another. Kneading is divided according to the part used. Number 1, whole hand kneading. Number 2, palmar kneading. Number 3, finger kneading. In finger kneading, we have 3 subdivisions. A, flat finger kneading. B, finger pad kneading. C, fingertip kneading. And number 4, thumb kneading. In this we have subdivision. Number A, thumb pad kneading. Number B, thumb tip kneading. And number 5th one is superimpose or reinforced kneading. Number 6, elbow kneading. Number 7, heel of hand kneading. So first coming to the whole hand kneading. Place the hand obliquely to the long axis of the part and maintain full contact using the entire palmar surface to be performed the manipulation. Second, palmar kneading. Use only the palm of the hand and allow finger and thumb to relax off contact with the patient. Great depth can be gained using the palm, so take care not to dig in with the bony prominence of the carpus. Number 3, finger kneading. In this we have A, flat finger kneading. This is performed with the palmar surface of the 2nd to 5th digit with the palm and thumb remains off contact. It is often used to work on less muscular or poorly padded area. In number B, we have finger pad kneading. This is performed with the finger pad either individually when index or middle finger are more commonly used, or with several finger pads together to provide a linear contact. The little finger may be too short on most people. Use index, middle and ring finger, which can be bent sufficiently to allow the pad to create a contact line. These manipulations are often used round joints and along the line of ligaments and in treating scars. In number C, we have fingertip kneading. This is performed in the same way as finger pad kneading, but only the tip of the pad, taking care to keep the nails off contact. Narrow or linear areas are dealt with using several fingertips, and one fingertip should be used on small structure or to work on painful area, when the patient will tolerate only very small contact and no movement of the part. In number 4, we have thumb kneading. In this, number A, thumb pad kneading. This is performed with the thumb pad. The size of the area to be treated dictates the amount of the pad which is in contact with the patient's skin. On the larger area, such as the forearm, back and the leg, the whole pad is used. The manipulation is usually performed by resting fingers on the opposite side of the limbs or near laterally on the back, but when working on the face or in the presence of any contraindications, the fingers should not rest on the patient. The skin and subcutaneous tissue should move on the underlying tissues so as to produce a wrinkle on the outer side of the working thumb. In number B, thumb tip kneading. This is performed more frequently with the side of the thumb tip and is useful when the part to be treated has a long, narrow shape as an interosseous space. In number 5, superimpose or reinforced kneading. This type of kneading can be very deep and is usually performed when a greater depth is required. The contact hand is rested fully on the part. Superimpose hand rests on the top of either obliquely across when working on the opposite side of the body or palm or finger when working on the adjacent side of the body. Number 6. Elbow kneading. This is performed by the bent elbow, which is placed on the area to be treated. The best available part of the elbow is used to form stationary circular manipulations, usually on the muscles of the interscapular region at the back or gluteal region, where greater depth is required. And number 7, we have heel of hand kneading. The whole heel of the hand is used, being careful not to dig with the pisiform. The palm and fingers are held off contact and a small circular manipulation is performed. Greater depth can be achieved by reinforcing with the palm of the other hand on the top of the working palm or holding the wrist with the other hand. Here comes the stroking. This is performed superficially to the skin to obtain a sensory reaction, either sedative or stimulative, and in which direction it is not important and is often from proximal to distal. And next one is percussion manipulation. The percussive manipulations are those in which the treated part is struck soft blow with the hand. They are performed either to assist evacuation from hollow organ or to stimulate either skin or muscles reflexes. Walking standing stance is the stance of choice for this manipulation. Percussion manipulation is divided into first, clapping, second, hacking, third, vibration or sacking, fourth, beating, fifth, pounding, number 6, tapping. So here comes the number 1, clapping. Clapping is a manipulation in which the whole palmar aspect of the hand is used to strike the body part. The hand is, however, cupped in such a manner that the center of the hand does not touch the part, but is hollowed. The fingers are slightly flexed, more so that at the metacarpophalangeal joint of the index, middle and ring fingers. The thumb is abducted so that it lies just under the index finger and adjacent palm. The wrist should be used to create the difference between striking a hollow surrounding blow and a slightly sharper blow. Second, we have hacking. Hacking is a manipulation in which the skin is struck using the back of the tip of the 3 medial fingers. The only movement required is that of pronation and supination. The elbow must not flex and extended. The hands are held at a small distance apart so that they rotate alternatively. They just clear one another. The arms are in slight abduction. The elbows are flexed to a right angle, with the forearm held parallel with the patient's skin and far enough above it to allow only the back of the little ring and middle finger to touch when the forearm is in supination. The wrists are well extended about 50 degrees. Number 3, we have vibration. Vibration involves a movement in which the tissue are pressed and released using an up and down motion. Vibration may be performed with whole hand or the fingertips. And number 4, beating. Beating is much less used manipulation in which the loosely clenched fist is used for the strike. The fingers are flexed at the metacarpophalangeal joint and proximal interphalangeal joint so that there is flat surface composed of the back of the 2 distal phalanges and the margin of the palmar surface of the palm. Number 5, pounding. Pounding is less used manipulation It is performed by loosely flexing the finger of all the joint, and the thumb lies flat on the lateral side of the hand halfway between abduction and flexion. Number 6. Tapping. Tapping is performed with the tip of the finger pad and is used on very small area such as face. The heel is hand relaxed over the area to be treated, and the fingers tap at the depth to produce a slightly hollow sound. The index finger and the ring finger may be used together or in any smaller number, or this finger may be used slightly in sequence. Next one, we have sucking manipulation. All long muscle bellies may be shaken, and the manipulation may be performed on the larger muscles such as biceps, the quadriceps, and also on the smaller muscles of the thenar and hypothenar eminence. Sucking manipulation for long muscles. The length of the thumb should be placed on one side of the muscle belly, and all the fingers are placed on the other side of the muscle belly. The palm should be off contact, and then hand is shaken rapidly from side to side as we transverse the length of the muscle belly, avoiding contact with the underlying bones. Stand in walk standing so that our weight is transferred from proximal to distal on the muscle belly. Next comes the sucking manipulation for small muscles. The tip of the thumb should be placed on one side, an appropriate number of fingertips placed on the other side of the muscle belly, and sucking movement performed. So here comes the conclusion of today's topic. Anyone can benefit from therapeutic massage when it is done by a fully qualified and competent practitioner. Massage is also applicable for people currently in treatment for medical conditions, people with disabilities, and expecting mothers, although further precautions that may have to be taken to protect the health of the patient. Those who are unsure about whether or not therapeutic massage is for them should consult thoroughly to find if there are any contraindications.